our guest is Dr. Justin Lehmiller. He is a podcaster, author, and sex researcher at the prominent Kinsey Institute that has been pioneering sex research for over 75 years.
Men have more multi-partner and non-monogamy fantasies. Men also fantasize about more taboo activities. By contrast, women fantasize more about passion and romance, and also kink and BDSM.
For some people, it's also realizing like the fantasies in your brain. So you have an off switch, right? If you don't want your fantasy to go in a certain direction, like say you're in a threesome with two other people, but you're the one getting all the attention, that's not necessarily going to happen in real life.
Why are they getting this information from porn? And it's because we're not giving them sex education, right? So porn has become the default form of sex ed for a lot of adolescents and young adults. As I often say, sometimes your eyes are bigger than your holes, right? And sometimes people in happy relationships cheat. And whenever I talk about this, I get some pushback because people will say, well, if you were in a happy relationship, why would you cheat? And that's where we need to look at the motives for infidelity.
So tell me, what's your sexual fantasy? I'm Dr. Rena Malik, urologist and pelvic surgeon, and welcome back to the Rena Malik MD podcast, your trusted source for evidence-based information about your sexual health and more. Today, we talked all about sexual fantasies. What do sexual fantasies mean about for you? What does it mean if you are interested in forced sex or maybe having sex with someone outside of your relationship? And what does it mean if you're interested in cuckolding? And what exactly is cuckolding? We talked about how pornography may play a role in fantasy, and also why is Gen Z the kinkiest generation yet? And how do your interests in sex change over a lifetime? What are some of his top tips for communicating with your partner about sex and dealing with issues of infidelity? He also shares with us his research when they interviewed people who had sex with someone of the opposing political party, meaning someone's beliefs who are polar opposites to their own. I hope you guys enjoy. Dr. Lehmiller, welcome.
Thanks for having me.
I'm so excited for this conversation. You've done so much work in the sex research space, and it's truly so exciting to have you here so we can delve into all that research you've done.
Well, I love talking about sex. It's what I do all day for a living. So,
yeah. And you actually published one of the largest studies on sexual fantasies and wrote books about sexual fantasies. So what are the most common sexual fantasies?
So for my book, Tell Me What You Want, I surveyed 4,175 Americans about their sexual fantasies. And in a content analysis, I found that there were really 7 major themes that characterize people's fantasies. So first, we have multi-partner sex, which is anything involving more than 2. Then we have power, control, and rough sex, which
is this an order of popularity or just in general 7?
Just in general.
Okay.
But multi-partner sex was really kind of the most popular fantasy. Okay. So second was the power, control, and rough sex. That's anything that falls under the BDSM or kink umbrella. Then we have the novelty and adventure fantasies, which are basically just about breaking free of your routines, trying something that's new and different, often just having sex in a different place or setting, like semi-public sex, for example. Then we've got the taboo fantasies, which is doing anything that is socially or culturally forbidden for you. Then we've got the non-monogamy fantasies, which are basically open relationship fantasies or infidelity fantasies, anything where they're just kind of exploring a different relationship structure. And then the last 2 categories are the passion and romance fantasies. So anything about emotional fulfillment, often just wanting to be wanted. And then finally, there were the gender bending and homoeroticism fantasies, which are about kind of pushing or testing the limits of your sexual or gender identity in some way.
Okay. So some of these make a lot of sense, right? Like multi-partnered sex, I'm sure is very common. Are there differences based on gender?
There are, but I should preface that by saying that there are more similarities than there are differences, right? So most of the things that men fantasize about, women fantasize about too. And it's also true if you look at people with trans and non-binary identities, like there's a lot of commonality. But if you look at differences between men and women specifically, some of the big ones are that men have more multi-partner and non-monogamy fantasies. Men also fantasize about more taboo activities. By contrast, women fantasize more about passion and romance and also kink and BDSM.
So when people very often get stressed or bothered by the fact that maybe they have a socially unacceptable or a taboo fantasy. What does that does that mean something about them? Is that something that means they should, because they have a fantasy, that means something about them?
So lots of people feel shame, guilt, or embarrassment about their fantasies. It's actually pretty normal to have conflicted feelings about them. And I think this stems from the fact that most of us are never taught anything about what is normal when it comes to sexual desire or sexual fantasy. And so many of us kind of feel alone in our fantasies. We think we're weird or strange or abnormal, that we're the only one who has this fantasy. And that's one of the things that my work has helped a lot of people to realize, which is that they're not alone in having that fantasy. And being able to feel normal for the first time is something that can be very liberating and freeing. And so I think we really need to understand the diversity of sexual fantasies to kind of help reduce a lot of that shame and guilt and anxiety, because odds are the things you're fantasizing about are the same things that most other people are fantasizing about too.
Yeah, I think one that comes up is any sort of forced sex or forced intimacy of some kind, which is very common, but I think people it blurs the lines because they're like, well, I don't really want that. Why am I fantasizing about it? So maybe shed some light on why people even fantasize about things they don't specifically want in real life.
So when it comes to our fantasies, sometimes a thought just pops into our head inexplicably. We don't know where it comes from. And it might be something that you want to do. It might be something that you have no desire to do whatsoever. I think it's important to recognize that there's a distinction between fantasy, desire, and behavior. So a fantasy is any sexually arousing thought or mental picture, something erotic that turns you on in your mind. A desire is something that you actually want to do. And a behavior is something that you actually do. Now, our fantasies can be desires. I find that for people's favorite fantasy, about 80% of folks say that their favorite fantasy is something they'd like to do. But that means about 1 in 5 say they don't want to do it. In terms of whether desire actually leads to behavior, that's a whole other thing. Sometimes we might want to do something and we're turned on by something, but actually doing it is scary or it's not practical, and so we don't do it. So fantasy, desire, and behavior are all overlapping concepts, but they're all distinct. To your point with the question, sometimes we have fantasies that we don't want to act out. And a big part of the reason why is just because sometimes people are unsure of how to do it. Like, for example, if you want to have a threesome, a lot of people think it's challenging enough just to find one other person to have sex with, let alone coordinate a whole group. Right?
Or the logistics of doing that.
Exactly. And then who does what with whom and when, the lack of understanding or knowledge of what's the script, how is this going to work. But then there's also fear that sometimes holds people back. If I were to act on this, what would actually happen if I did that, and could I get hurt or could my partner get hurt, depending on what the fantasy is. And that could be physically or it could be emotionally hurt, so it's a lot of fear and uncertainty that kind of holds people back from acting on their fantasies.
Yeah, and I think for some people it's also realizing the fantasies in your brain. So you have an off switch, right? If you don't want your fantasy to go in a certain direction, say you're in a threesome with 2 other people, but you're the one getting all the attention, that's not necessarily going to happen in real life. Or if you're having forced sexual intimacy, you also can stop or, whatever things you like and whatever you don't like won't happen in your fantasy. And so I think it doesn't necessarily mean that you want that in real life, because there's no off switch. You can't turn it off or make it follow your script that you want.
Yeah, the element of control is really the key aspect here, right? And I find that a lot of women with forced sex fantasies say the fantasy of this really turns me on, but I would never want to do it in real life because I wouldn't be in full control of the scenario, right? So with forced sex as a fantasy, you get to control who the partner is, how the encounter begins and ends, and you're in complete control the entire way. But if you want to act that out in real life, you have to give up some of that control to someone else, and that's where it can get a little risky.
Yeah. And sometimes people will fantasize about someone else, and specifically that someone else could be closely related to their partner. It could be a sibling, it could be a best friend, it could even be a parent, right? And that can be very distressing for someone. And sometimes they might confuse that with desire for that other person. So what do you tell people in those circumstances?
If they're fantasizing about someone who's not their partner?
Well, no, but specifically like someone who's very close to their partner. So it's almost like you're often like, it's one thing if you fantasize about like a celebrity, right? Like you're never going to really interact with them, but someone that you may interact with quite often, like a family member, a best friend, someone that's in your life. And then you're like, oh my God, I fantasized about this person and now I feel weird. Like, do I like this person? How should they handle that?
It's a tricky question, right? So I find in my research that a lot of people have, I guess, what I would call forbidden fruit fantasies.
Yeah.
They fantasize about people that they're not supposed to fantasize about, like their partner's best friend, even their partner's sibling, their best friend's spouse, right? So it often happens in our fantasies that we are picturing people who are unavailable or who it would be, let's say, complicated if we were to get involved with them. I think in many cases, the fantasy doesn't really mean anything. It doesn't mean that they want to act on that. The thought maybe just popped into their head. And sometimes people feel like morally conflicted or guilty about this, like I shouldn't be fantasizing about that. But I think it's important to recognize that most people don't just fantasize about one person forever. Most people fantasize about a range of partners. And just because you fantasize about somebody who isn't your partner and somebody who might be forbidden, it doesn't mean that you're going to act on it. And it doesn't mean that you're a bad person.
Do people who describe themselves as people who have frequent or more vivid fantasies, are they more sexual, less sexual? Is there an archetype of a person who fantasizes more often?
There are a couple personality traits I find that are linked to very frequent fantasizing. One is simply having what's called a fantasy-prone personality. And these are people who daydream a lot. They're kind of always in their heads. They have very frequent fantasies. Then there are also people who are high in the trait of openness to experience. People who are just generally more open to trying new things. They also fantasize a lot more. Now, in terms of whether they are more sexual, in terms of actually behaving in more sexual ways, it doesn't always translate to more behavior. Just because you fantasize more doesn't mean you're going to act on it more.
What about fantasy and pornography use? Is there a link between those two factors?
They are linked, and a lot of people talk about how porn maybe influences or shapes our fantasies, and it does to some extent. So I asked my participants, for your favorite fantasy of all time, where did it come from? And I gave people a whole range of options they could choose from. And some people could clearly identify that, hey, this fantasy was related to a previous experience that I had, or it was related to something I saw in porn. But for many people, they don't know where it comes from. But I think it's about one in 6, 1 in 7 people who said that their favorite fantasy, they could connect to something that they saw in porn. So porn can and does shape our fantasies, but more often than not, people are going to porn as a way of vicariously living out their fantasies. So they're more likely to search for porn that overlaps with their preferred fantasy content.
I've said this before in videos, but that's sort of like a use of porn that's actually sort of useful or beneficial for some people, where they may have a fantasy that is socially inappropriate, taboo, and they really just want to see it happen in a entertainment sort of form. And so they can utilize pornography for that in a safe way while still maintaining all their normal relationships, everything else that they're doing.
I get that different people have different opinions about porn, and some people think that there shouldn't be any porn at all, right? But porn is one of those things that for the vast majority of people, it doesn't cause negative effects. When you survey people about how porn use affects their life, most people report either no effects or positive effects. There's a small minority who do report negative effects, and it's important to talk about them and focus on, what is the reason why it's having negative effects and how can we help them. But oftentimes the people who are reporting negative impacts of porn are people who are just morally conflicted about their porn use. So they're engaging in a behavior that they don't think they should be engaging in, and it creates a state of cognitive dissonance. And one of the ways people try to resolve that dissonance is by labeling themselves as porn addicts, because by using that addiction label, it shifts the blame to a disease process as opposed to placing the blame on the self. So in some ways, it can be kind of a self-protective mechanism.
You're preaching to the choir. I was on the Diary of a CEO podcast talking about pornography, and the response to and the vitriol towards pornography was more than I expected. I mean, I knew it was there, but I was like, wow, this is amazing that people really, at least vocally, want to get on some sort of moral high ground to discuss how horrible pornography is, when we know it is very highly consumed. So hard to say who's commenting how much porn they're really watching at home,
Yes.
I saw somewhere that people didn't realize they were having sexual fantasies. Does that actually happen? Do people not know they're having sexual fantasies?
Well, so I find in all the studies I've done on fantasies, there's about 2 to 3% of people who say that they don't have fantasies. And, whenever I give talks or lectures or workshops about this topic, the assumption of a lot of people is that they're just lying, like that they have fantasies, but they don't want to admit to it. And I think some of them might be lying, maybe because they have a fantasy that they're very uncomfortable with. But I think there are some people who really don't have fantasies, at least in the form of mental images. So some people have what's called aphantasia. In other words, kind of don't have a mind's eye. Like they can't create mental pictures of anything, whether it's sex related or not. And it doesn't mean that they don't have fantasies, but they maybe just have fantasies in a different way. So it might be more of a feeling as opposed to a mental picture. And in that 2 to 3% of people who say they don't have fantasies, there are also some folks who have fantasies, but they just don't count them as fantasies. So some people seem to be under the impression that for something to be a fantasy, it has to have fantastical elements, like it has to take place in outer space or at Hogwarts or on the Starship Enterprise. There were lots of Harry Potter fantasies.
Fantasy. Okay.
One of my favorite Harry Potter fantasies that I heard from a participant was they said their fantasy was about being with Harry and his 2 magic wands. Magical threesome.
Yeah, I could totally see that. Okay. There's another fantasy that I think people talk about often that's not discussed often enough, but it's cuckolding. So let's describe what is cuckolding and how common is that fantasy?
So cuckolding is basically where you're turned on by the idea of watching your partner have sex with somebody else, right? And there's also a flip side to that where you could be turned on by the idea of having sex with somebody else while your partner watches. So there's kind of like exhibitionistic cuckolding where you're putting on a show for your partner. And then there's voyeuristic cuckolding where you're interested in watching your partner put on a show. And I find that cuckolding is a very popular fantasy. A majority of men, I believe around 55 or so percent, say that they fantasized about it before. A minority of women have had this fantasy too, but it's much more common among men. And if you start to break it down by roles, women are more into the exhibitionistic cuckolding where their partner's watching them, and men are more into the voyeuristic side of things and watching their partner.
Are you sick of going to the doctor only to have them talk at you for 15 minutes and leave without knowing exactly why they're prescribing you this certain medication and what exactly the next step is to take to optimize your health? Wouldn't it be great to finally find a doctor who actually listens to you, answers your questions, and doesn't rush you out the door? Well, at my practice, Rena Malik, MD, I aim to do just that. I specialize in taking care of patients who have issues with their sex lives, issues with their bladder, with their hormone health, or are having pain in their pelvic region or with sex. My goal is to give you the time and attention you deserve so you can leave with a clear understanding of your condition as well as our treatment plan that's optimized for your goals. During your visit, I'm 100% present with you for an entire hour. And after you leave, you can reach me. It is super easy to send me a message through our secure portal, and I'll get back to you within 24 to 48 hours. No questions asked, no hidden fees. Scheduling is easy. Just visit our website, renamalicmd.com/appointments. We see patients in both Irvine and Beverly Hills, California, and I see patients virtually in California, Florida, Illinois, Maryland, New York, New Jersey, and Virginia. Oh, and don't forget Texas. If you're outside these states, consider seeing me for an educational visit. I look forward to seeing you.
It's so interesting. I've spoken to some men who are considered like aspirational by other men, and they've told me that they don't get, so as a social media personality, I will get propositioned right in my DMs. They don't get propositioned by women, they get propositioned by other men to have sex with their partners. So I didn't realize it was such a common, not only fantasy, but desire by men to see this or have this happen with someone that they see as aspirational. Why do you think this is so common, or not so common, but common enough that it happens?
As with any fantasy, different people can be into it for different reasons. And, there is a variant of cuckolding. It's often referred to as hot wifing, if it's male-female couple, where the appeal of it for the man watching his partner have sex with another woman and being desired by other men is that he's kind of getting off on the idea that he's with a partner who is just so hot and that other people want to be with her. And it's kind of like a status and an ego thing in that way. For a lot of cuckolds, the appeal for them is that there's kind of like a BDSM element to it, where the idea of watching their partner be with somebody else is humiliating, or it's an act of masochism. Sometimes these guys, if you watch cuckolding porn, and I've watched some of this porn for research purposes because I actually wrote an article for Playboy about this a while back that went viral, and I needed to understand the fantasy, so I watched some of the porn, and in a lot of this pornography, guys are wearing cock cages, these chastity devices while they're watching their partner have sex, and sometimes he's being humiliated for having a small penis in the process too. So there's that BDSM element that is a big part of the appeal for some folks. But there's also for some guys a compersion element where they take pleasure in their partner's pleasure. And so seeing their partner be fully satisfied is what gets them off. So it could be some or all of those things. It kind of depends on the person.
Let's dive into that humiliation factor, because I've understood the dominance factor, right? Where you maybe want to let go of control. A lot of times we see a lot of people who are very dominant in life wanting to be submissive in the bedroom because they finally get a chance to be submissive. But tell me about humiliation. Why are people enjoying that aspect?
So humiliation is a form of masochism, right? It's painful to be humiliated. And some people are just turned on by pain, whether it's physical or psychological. There's something that is uniquely arousing about it to them. And part of what is appealing to folks about masochism in general is that it changes your headspace and it creates this kind of escape from self-awareness and allows you to kind of like be more present and in the moment. There's something that is centering about pain that makes you forget about the outside world and everything else that's going on in life. So some people in the kink community will refer to this as subspace. When you're engaging in submissive or masochistic activities, there's just that change in headspace, escape from self-awareness that is part of the appeal. Again, different people can be into it for different reasons, but that's one of them.
Interesting. And then the chastity belt or any sort of chastity device. I get a lot of questions like, is it safe? Is it safe? And I think as long as you're not like having prolonged erections and like they're forced down with any sort of device, it's probably safe. I've also been curious from a psychological standpoint, why do people find that appealing?
So it's sort of the orgasm denial piece is often part of it, but it's also kind of about the humiliation and the masochism. And again, it's different for different people in terms of what is appealing to them about it, but there can also be a pain element associated with, wanting to, you're turned on and your penis wants to get erect, but you're not allowing it to. And so it's, there's a lot of things that are going on there and why it might be appealing to some folks.
Interesting. You wrote an article called Gen Z is the kinkiest generation yet. So we've heard things about Gen Z. They're not having as much sex, but now they're the kinkiest generation. Why do you think that is?
We see this in a lot of different data sources. So in my own data on sexual fantasies, I see that young adults report the most kinky fantasies. And I've actually plotted this out by people at different decades of life. And you see that kink fantasies are highest for people in their late teens through their 20s, and then they sort of decrease over the lifespan. Just as an interesting aside, like fantasies seem to change in a lot of different directions as we age. And so while kink seems to go down in older age, people actually become more interested in non-monogamy and threesomes as they get older, right? There's this kind of this stereotype of young adults as being wild and crazy, and they're all having threesomes and kinky sex, but no, it's mostly just the kink, right?
Okay.
We also see this in a project I did with the dating app Field, where we surveyed members of that particular app, and we find that they were the most likely to report that they've discovered a new kink since using that app. And we also see this in research by Dr. Debbie Herbenek and colleagues, where there's this rise in sexual choking among young adults, along with other kink behaviors. And in fact, 1 in 3 young women report that they were choked during their most recent sexual encounter. Right?
Yeah, Debbie Herbenek was on the podcast with me, and I was so surprised. I had no idea how common it was. It was as common as like kissing, for example, in foreplay. And, she had discussed it's likely due to the exposure to these sorts of things in pornography. Would you agree with that?
I think porn is part of the explanation, but we have to step back and say, well, why are they getting this information from porn? And it's because we're not giving them sex education, right? So porn has become the default form of sex ed for a lot of adolescents and young adults. So it shouldn't be any surprise that they're learning from porn because they're not learning about it anywhere else. And it's unfortunate. And I think it's part of the reason why we not only need better sex ed, but we also need porn literacy and sex ed to help young people contextualize what they're seeing on screen, and that porn sex isn't the same as real sex.
100%. I try my best to advocate for teaching your kids about sex, teaching your kids about pornography, and hopefully someday I will make a free sex ed course on YouTube. I have not done that yet, but I just feel like this is so needed. I mean, it's not the school's fault. They only have so much time to teach kids everything they need to teach in the curriculum. So they teach them, safe sex, using a condom, consent. Those are all basic pillars of sexual education, but they don't get into knowing their anatomy, what's normal, is it normal to have even nocturnal emissions or wet dreams, right? Like I was like, I haven't talked to my kids about that yet. I better start thinking about that because they're getting older. And so, I think it's an evolving thing that we have to take on as parents, and we can't bury our heads in the sand and just say someone else will take care of it because that someone else is pornography.
Parents do have a responsibility here because, the schools aren't teaching it. And where else are the kids going to learn about it? And if they're not going to learn about it from school, that means they're probably going to learn about it either from their friends or through porn. And their friends might know even less than they do.
Yeah.
And their friends just might also be regurgitating things that they've learned through porn, but also through social media. I think part of the rise in rough sex among young adults is just kind of the normalization of rough sex on social media, where you see memes that say things like choke me daddy and so forth. And so when it's presented in this way that's normalized across multiple contexts, I think it leads a lot of folks to think that, this is just the way that people have sex. And for some people it is. And if they enjoy it and it's all consensual and they're practicing it safely and in a risk-aware way, that's fine, no judgment. But for people who are coming at this without really knowing anything about safety practices, and that's where it starts to get problematic. And also when they don't ask their partner first before they engage in this behavior, that's very problematic as well.
Yes, absolutely. And especially with choking, right?
Yeah.
I mean, you could really harm somebody or cause brain damage if too long, too forceful. So those things are really important to get consent for, and to understand that if it's a man doing it to a woman, which is more common, you're stronger and bigger. By nature, for the most part, for most, that's always most likely going to be the case in most relationships. And so it's something to be really careful about.
And related to that, when it comes to porn, like I often liken porn to watching a cooking show where you're kind of like just seeing the highlight reel, right? And you're not seeing all of the behind the scenes action that happened. You're just kind of seeing a little bit that went into it and then the finished product, and that's it, right? So in porn, you're not seeing the advanced negotiation that went on between the partners where they talked about their boundaries and what they were comfortable with. You don't see where they stopped to take breaks and where they reapplied lube and checked in with one another to make sure that everything was fine. And when people don't see all of that, they just sort of lose the context for this. And that's where things can kind of go awry, and why porn is a terrible way of learning about how to have sex.
Or used aids to maintain their erection for longer than usual, or even had a penile implant. I mean, this is real stuff that happens in pornography, and they're creating a product. By all means, they're doing what they, people are willing to go watch and pay with their eyeballs for watching ads, and they're making money at the back end of it. So it is, if we stopped watching porn, there'd be no you have nothing to complain about, right? But people are watching it. So clearly there's a desire for it and there's an appetite for it, and we have to have porn literacy. I want to switch gears a little bit. You talked about novelty as a fantasy, and I think novelty is really, really important, especially in long-term relationships or even, shorter term, but, you're getting sort of into a sexual script that you follow with your partner. So what are some tips you have for people who want to incorporate novelty into their sex life?
If you've never really done this before with your partner, I think a good starting point is first by kind of like normalizing sexual communication, right? And just get used to kind of talking about sex first before you start bringing new things into the bedroom, because anytime you're trying new things, it can be a little bit stressful and there's potential for things to go wrong depending on what kind of new thing you actually want to try. So start first by working on the sexual communication piece. And then in terms of introducing novelty into the relationship, be careful in terms of how you bring this up to your partner, because if you're telling your partner you want to try something new, sometimes that gets interpreted as you're not happy with the sex that we're having, or you're no longer attracted to me, or I'm inadequate or insufficient in some way. So I think a good way to introduce the idea of saying you want to try something new is to start first by complimenting your partner and saying, I love the sex that we're having and I find you really hot and attractive and so forth. And I was thinking maybe it could be fun to try this new thing. And I think we'd both enjoy it and it'd be a lot of fun. And so when you sort of pitch it in that way, it reduces the risk that your partner is going to take it personally and that it's going to devolve into a conflict discussion. But then when it comes to actually trying it, I think it's important to kind of start low and go slow. So if you and your partner want to try sex toys for the first time, maybe don't buy the biggest dildo you can find, right? As I often say, sometimes your eyes are bigger than your holes, right? And so, kind of start with baby steps, including if you want to explore kink and BDSM, like it's baby steps to whips and chains, right? Maybe just start with a blindfold, just try one little new thing and get some practice with that, because when you're trying new stuff, you just kind of need a little time to build up trust and intimacy and so forth.
Yeah. And I think the other big thing is just like it's play, right? It's supposed to be playful and fun, and like things will go wrong. Inevitably, something weird will happen. You won't like a stimulation. You'll be turned off, or whatever, right? Something may happen. Laugh it off, move on, like try again the next time. Everything that you want to try takes a little bit of practice, right? So, and it doesn't have to be crazy, right? I don't think you have to bring out whips and chains. It can be as simple as you mentioned as like doing it in a different location, maybe not in a public setting, but in the kitchen or in a different room.
Yeah. Any room in the house can potentially be a sex room, and anything is a sex toy if you're brave enough.
Well, I would argue I've taken too many things out of urethra, so please don't use anything as a sex toy. Just things that are meant to go in those orifices that have flared bases, please.
I agree.
We talked a little bit about novelty and fantasy and fantasizing about other people outside of your relationship. But what about if you're in a relationship and you're concerned that maybe infidelity is going on? Are there certain red flags that you can identify in a relationship?
If you're concerned that your partner is cheating, it's one of those complicated topics, right? Because oftentimes people will assume their partner is cheating when in fact they aren't. And part of this comes down to your attachment style, right? And people with anxious attachments are more likely to take ambiguous information that they have about their partner and assume the worst and that their partner is cheating. So it's important to step back first and kind of check in with yourself and say, where is this anxiety coming from? And is that clouding my judgment in terms of what's actually going on here? Because maybe the fact that your partner just went out to a happy hour with someone or commented on somebody's Instagram post who really attractive, like that doesn't necessarily mean that they cheated. Like, where's the insecurity coming from first before you jump down your partner's throat and accuse them of cheating? Because when you do this and your partner's not cheating, that really tends to disrupt the relationship and take it in bad places. So I don't know that there's any way you can know for sure that your partner is cheating short of you asking them or catching them in the act or, finding out through, say, a friend or somebody else who has seen them engaging in this behavior. So if it's something that you are concerned about, have a discussion with your partner about it. But I think also kind of check in with yourself about that anxiety piece first, because for people who have that really anxious attachment, this becomes a recurring issue. And then it starts to become really destructive to the relationship over time when one partner is constantly accused of cheating when they're not actually doing it.
I think that's definitely true.
Quick break from this episode to let you know I am so grateful that you're spending part of your day with me. I started creating content online to empower people to learn more about their bodies without needing to go see a doctor, pay a copay, wait in a waiting room, or find parking. And it has been one of the most rewarding experiences of my life. If you want to help support our mission of providing free education, please consider joining our premium membership. There you will have access to ad-free episodes, which are released early, as well as free transcripts and the opportunity to ask me anything. And these questions are answered in our monthly AMA episodes. Support the show and join today at renamalik.supercast.com. Can't wait to see you there.
Are there certainly I think people cheat for all sorts of reasons, and we can talk about that. But are there certain, you've probably talked to people who have cheated before. Are there certain patterns that you've seen? Is it you would have never guessed? Or are there certain things that sometimes they're actually, there's been a little bit of this, a little bit of that sort of runs in a pattern?
Well, so here's where it gets tricky. Different people cheat for different reasons, and sometimes people in happy relationships cheat. And whenever I talk about this, I get some pushback because people will say, well, if you're in a happy relationship, why would you cheat? And that's where we need to look at the motives for infidelity. And one of the common motivations people report is that they've lost themselves in their relationship. And these people love their partners and they otherwise have great relationships, but there's sort of this search for the self that happens with some people in long-term monogamous relationships that prompts them to cheat. And it wasn't because the relationship was in a bad place. It was more about kind of something else that was going on in their own personal life. It's a complicated thing because sometimes people will assume that they're immune from infidelity just because they're in a happy relationship, but a happy relationship isn't a guarantee that you or your partner won't go out and cheat at some point. But, in terms of factors that might be a sign that somebody is cheating, we do see in the data that there is a lot of relationship discord that is associated with infidelity. And so there's usually a lot of relationship turmoil first before somebody goes out and cheats, right? So if there's a lot of conflict in the relationship, if your partner disengages more from the relationship, if their regular habits, patterns, routines suddenly start to change, these could be potential indicators, but, I would just be cautious because there's not one universal red flag that anybody can look out for.
Yeah. And I think probably asking them about those behaviors rather than saying, hey, are you cheating on me? Are probably a better way to start rather than going straight for, I think you're cheating on me because XYZ is going on. Because they could also be depressed. They could also be going through some internal turmoil. There could be something going on at work. They could be dealing with sexual dysfunction, right? All those things I think can cause a lot of those issues as well.
Something else that could potentially be a sign would be if your partner suddenly starts keeping more secrets. Let's say they change the passcode to their phone and, do other things to try and make it harder for you to, say, monitor them, right? That could be a potential sign as well. But yeah, again, it's better to kind of have the conversation with your partner more broadly about the behavior instead of just saying, hey, are you cheating? Because it doesn't go well.
How do people get through infidelity? Those that do it successfully.
Yeah, so there have been some longitudinal studies of people who have committed infidelity, and they looked at, what was the impact, what happened in the relationship. And we find that people fall into a few camps. One is that the infidelity was never discovered or disclosed, and people just go on with the relationship, right? Then you have people where the infidelity was discovered, and then they're split into two camps further between those who end up staying together and then those who break up. So infidelity is sometimes the end of a relationship, but not always. And sometimes the relationship comes out stronger. And I know that sounds paradoxical, but sometimes that infidelity is the thing that prompts people to reevaluate their priorities in life and in their relationship, and it improves their communication, and ultimately they restore trust and things move on. But I find with infidelity, the people who successfully work through it often get some help in the form of speaking with a sex or relationship therapist, because it's a complicated issue and it's a major trust violation. And a lot of people just don't have the skills or aren't equipped with the skills to navigate that on their own. So I recommend, reaching out to a certified sex and relationship therapist. A handy way to do this is ASECT, which is the American Association for Sexuality Educators, Counselors, and Therapists. It's kind of a mouthful. It's why we call it ASECT. But if you go to their website, they have a therapist directory where you can search for a certified professional near you.
I look it up all the time because I have patients from all over the country. So I'm constantly going there and being like, here's the list. It's very helpful. It's very good. So absolutely use it. And, I think the other thing we've talked about a lot today is communication. So you've talked a little bit about getting better at communication, but what tips do you have? What are some tools people can use when they start talking about sex with their partner? Because I've seen couples who've been married for 20 years, they've never talked about sex, and I've seen couples who have been dating for a few weeks and they've been talking about sex since they started dating. So I think it's they run the gamut where it's new relationships, long-term relationships, but talking about sex, we're not taught how to do it. People don't know how. And so how do you start? What are some tips?
So yeah, this is one of those things, because the single most common piece of sex and relationship advice you're going to hear is communicate more, but nobody tells you how to actually do that, right? So practical tips. I think one place to start is to not just have superficial conversations about sex. Lots of people will say that they talk about sex with their partner, but ultimately that just amounts to, after sex, they'll say, was that good for you? And it's kind of that's the extent of it. So I think you can start by building on those conversations in baby steps and say, well, what was it that you liked about that experience? And is there anything new that you might want to try next time? And so it's just sort of slowly elaborating on what you talk about and building that. And, another part of communicating about sex is having reciprocal exchange, right? So this is the way that trust and intimacy are built in relationships, is through self-disclosure and vulnerability. And so it can be talking about your fantasies, your desires, your turn-ons, and take turns sharing them, but don't start with your most adventuresome fantasy right away. Start with something at the more mild end of the spectrum as a way to just sort of break the ice. And I think another tip that can help people is, sometimes it is hard to say face-to-face to somebody what you're feeling about your sex life. And sometimes it's easier to type things out. And so maybe it's you have this conversation over text as opposed to in person, face to face. If you find that helps, great. I mean, you can also use certain apps to kind of facilitate discussions and conversations. So there are two that I recommend. I don't have a financial stake in either of them. I wish I did, because I recommend them all the time. But one is called X Confessions. The other one is called Own Your Sex. And they're both sort of like Tinder for sexual fantasies, where you each download the app, you sync your accounts, and then you take a quiz privately where you sort of indicate what your turn-ons are. You swipe right on the things you're into and left on the things you aren't. And then the app will compile your interests for you as a handy way of helping you to hone in on what both of you are into. And that can be an easy way to sort of, make the conversation a little bit less stressful, right? When it comes to talking about your wants and turn-ons.
It's a nice gift too. You can just say, hey, let's try this out. This could be fun, And there are some really fun games. I think there's different types of card games where you can ask questions, sort of what is that one? Something about humanity, Cards Against Humanity. But there's, versions of it that are figuring out about your sexual interests, which, I think those are all really fun. And that's a playful way to incorporate it and, sort of talk about it.
And you can also make up your own game, right? So I think Would You Rather is a fun game to play. So would you rather be tied up or tie me up, right? And it's just sort of a way where you can kind of feel each other out in terms of what your interest might be. It's sometimes an easier conversation than saying, what's your fantasy, right? So, if you can turn it into a playful game, it can be a lot of fun.
Yeah, sometimes I'll tell people just write your own fantasies down, just for like write it on a piece of paper, throw it away when you're done, doesn't matter. But just like you may not have ever even given yourself a moment to like think about it, and maybe encourage your partner if you're open enough to do that at that point in your relationship. And then like, if you decide to share with each other, great. But it's also just good and therapeutic to like see like, hey, I've always wanted to try this. Like, let's talk about it,
And it can also be fun too to go to a sex shop together, right? Or you could just visit one online, browse the products, and just sort of use that as an opportunity to talk about them. And is there anything you might be interested in trying? And how might somebody use that, right? And so there are all kinds of ways that you can just sort of break the ice, make it easier to talk about sex. And once it becomes easier to talk about it and you have that trust built up, then you can, really start to get into the deeper conversations. But I think one thing that is important in communicating about sex with your partner is to not only talk about it when there's a problem. Talk about the sex when it's good, not just when it's bad. Because when you only talk about the bad stuff, that makes every conversation about sex so fraught, because you bring it up and then your partner's going to shut down and feel defensive, and it's just probably not going to go anywhere good.
Yeah, absolutely. 100%. I think you wrote something on becoming a good kisser once. Did you recall this? It might have been a few years ago.
I recall writing about some research that looked at how people describe their very best kisses and their very worst kisses. And I think what was interesting about that was that when people think about their best kisses ever, it was about emotional spark that they had with this other person. There was this intensity, this chemistry. And so the best kisses are often just about, that connection that people have. By contrast, the worst kisses were all about technique, like that there was something gross or unpleasant about it, right? That they produced too much saliva, or their tongue was touching the back of your throat, right? And I think when it comes to, how do you be a good kisser, it's important to first recognize that not everybody likes the same kind of kisses, right? And to some people, you might always be a bad kisser because they, just don't like that particular technique. So you kind of have to adapt it a little bit to your partner, because everybody has different sorts of preferences there. And so there's a little bit of trial and error, with kissing and with sex, and figuring out what it is that your partner likes and enjoys when it comes to specific kissing techniques.
But it seems that chemistry makes a difference.
Chemistry absolutely makes a difference.
Like, I guess it's hard to say that like you're so attracted to someone's personality and then all of a sudden like it just falls flat. Like that's not as common, but when it happens, do you think people can get over that?
If the chemistry goes away, or sorry.
So meaning like they've got great chemistry, like sitting down, talking to each other, being together, flirting, all that. And then they go to be intimate and it's like a total mess.
That does happen sometimes. Sometimes the chemistry isn't enough. And there can be an interaction between technique and chemistry where if, you're really into somebody else, but then they have one of those really unpleasant techniques, or they just ate like a whole bunch of garlic right beforehand or something.
Please don't do that.
That can become something that sort of kills the spark, right? It does happen. Be careful, brush your teeth, maintain good oral hygiene.
Good hygiene in general is always good.
Are you feeling in a rut in the bedroom, wishing you had the kind of sex life you could brag about? I've spent years helping patients and creating content for people all around the world to improve and optimize their sex life. Today, you can get my knowledge for 100% free with my new ebook called Better Sex, Better Life. In this ebook, I review my top 10 tips for improving your sex life, all from the comfort of your own home. All you have to do is go to renamalikmd.com/morepleasure to download it for free today.
There was also a paper that I thought was I don't know if it got published or it was a preprint, but it basically looked at people who keep their relationships a secret and how well their relationships are accepted by their family and friends, and how that was correlated with how much sex they had in that relationship. And I actually found that if you kept your relationship a secret, or your relationship was less accepted by people around you, you had more sex. Is that right?
So there are some people who find secrecy to be exciting, and they do have more sex. But In my work, I find that that tends to be more in the short term, right? When people are kind of in the early stages and they're sneaking around, there can be something that's exciting or titillating about that. And that's the way secrecy is often depicted in the popular media. When somebody's in a secret relationship, it's almost always depicted as this exciting thing and they're having sex all the time. And so that can happen, but secrecy over time starts to become onerous. And so if you're in a really long-term relationship where you have to keep it secret, and especially when you have to keep it secret from all of the important people in your life, that starts to become stressful. And then that can start to interfere with your sex life and with your connection with a partner. Secret relationships was actually the topic of my doctoral dissertation. And I published a few papers on this, and I have one longitudinal study that I did where I found that long-term secret relationships, people were actually more likely to break up after a year. And it was because it became more taxing, more stressful, and that also put wear and tear on their mental health and physical health as well. So they actually reported worse health outcomes over time just because the pressure of having to keep things secret and not having social acceptance for many people just becomes too much.
Yeah. Interesting. In terms of masturbation, you've done a lot of work on this. What are some of the health benefits of masturbation? I mean, there's some people who accept it widely, and there's some people who think masturbation is just horrible, should never be done, but there are some health benefits. So let's review some of those.
Yeah, so masturbation can be healthy for us in many ways. And if you look at the most common reasons people report for masturbating, one of the biggest ones is stress and tension relief, right? So just as a form of self-care for, dealing with or relieving stress in your life, that can be one benefit. We also see in the work that masturbation, particularly to the point of orgasm, can also help people sleep. They fall asleep faster and they get better quality sleep when they masturbate before bed, right? And sleep is so important, so vital to overall health and function. So that's another benefit. There's also some work finding that men who ejaculate more frequently through both sex and masturbation have a lower risk of prostate cancer. It's not cause and effect, but there is that association there. So maybe it has some potential health benefits in that way. There's also some work finding that masturbation is linked to higher self-esteem in women. And I think that can be explained in part by masturbation helping you to better understand your own body and what it is that brings you pleasure. And that can make you more sexually confident as an individual. And then there's also some new research that we conducted at the Kinsey Institute this year in conjunction with the sexual wellness brand Womanizer, where we looked at the role of masturbation in menopause symptom relief. And what we found was that in a sample of menopausal women, that masturbation was reported as one of the most effective techniques for reducing a wide range of menopause symptoms. And it makes sense because masturbation can help you to sleep better, right? And so that might help in dealing with certain menopausal symptoms. But also, it was linked to women reporting less vaginal atrophy as well. So there's also some data and other research finding that women who masturbate more, who are in menopause, show less vaginal atrophy over time. And so there can be lots of potential health benefits there across the lifespan in terms of engaging in masturbation.
There was a lot of blowback from that article. And I think that the important take home is there could be benefits. We're not saying you shouldn't get treatment for menopause in terms of hormone therapy, but absolutely, if you enjoy masturbation, it could be a good tool to help you sleep better, get more blood flow to the region, and help overall in a multitude of ways. And I think that's the key with masturbation or self-pleasure in general, is that it could be used for a lot of disease conditions, right? To help with pain, to help with a lot of different things. But people tend to get very fixated on the morality of masturbation and also how difficult it is to get funding. I mean, you guys are obviously very good at that, but it is very difficult to get funding to say, hey, I want to test if masturbation helps, PCOS or whatever the condition is.
You're not going to get government funding to do a study like that. But when it comes to, masturbation and its health benefits, it can be used in conjunction with lots of other things in your life. We're not saying that masturbation is the only strategy you should use for improving your health. But if you're talking about menopausal women, you can use masturbation in conjunction with hormone therapy. It's not an either or phenomenon. I just think it's a useful tool that we can use as a form of self-care that might also have some health benefits. And I realize masturbation may not be something that everybody is open to doing. And there are various reasons why people might not be open to it. And also for some people, masturbation might not be as accessible. As you get older, sometimes chronic health issues, disabilities can make it harder to engage in masturbation. Certain sex toys can become harder to operate and things like that. So yeah, there can certainly be challenges sometimes in terms of accessing the potential benefits of self-pleasure.
Yeah, there is, however, sex furniture that you can get that can help you, particularly if you're older. I've made a video on this. I think it's like sex after 60. But basically, like, you can buy certain things to help you get certain positions, be able to even, like, we actually have things for catheterizing. So when women catheterize to open up the labia, so you could use those. There's a whole host of things that you can do to help yourself if you want to, right? And I think that's just for people who may be curious that, if you can't get certain positions because you have arthritis or it's difficult or holding yourself up or whatever, whatever position you normally do is no longer attainable to you, there are ways to help yourself with that.
And, that's one of the keys to maintaining a satisfying sex life throughout your entire life is to get a little bit creative and to try some new things. And sometimes the answer is buying sex furniture. The single most common complaint that seniors report when it comes to sex is that the old ways don't work anymore. And so you need to find new ways because your body changes. What feels pleasurable to you changes. What you desire, what you fantasize about might change as well. And so having an ability and openness to explore is really important, but also expanding your definition of sex. Like, sex isn't just one thing. It's not just penetration. And the older adults who are the most satisfied with their sex lives have the most expansive definition of sex. They see sex as intimacy as opposed to sex as penetration.
Yeah. And apparently in the nursing homes, there's a lot of sex. And
a lot of STIs.
Yeah. Still use a condom or a dental dam or something. But yeah, absolutely. So you gotta figure out new ways, new tricks. So what are you working on right now that you're excited about?
Oh boy. Well, I have a paper I'm working on right now that I think is really interesting. It's about people's openness to dating and having sex with people who belong to different political parties than they do. And I think it's an important topic given that we live in this highly politically polarized time, right? How is this impacting the world of sex and dating? And one of the interesting things I see in that research is that men, regardless of their political background, are much more open to the idea of sex and dating with somebody who belongs to a different political party. By contrast, women are much less open to it.
Really?
And I think a big part of the explanation for that is that politics is more personal to women in a lot of ways, especially when you talk about things like the Me Too movement and growing restrictions on women's reproductive rights and freedoms. And so, politically, being with somebody who is different from you, many women perceive that as a threat to women's rights. And so it's something that can provoke fear or anxiety or safety concerns. By contrast, for men, many of them seem to find something uniquely arousing about the idea of being with somebody of a different party. There are some guys who actually even hire professional dominatrixes to engage in kinky political role play, right?
Wow.
There's something going on there.
Yeah, that's interesting. It's maybe like a challenge to who you are or something that you find you're taking on or you're conquering almost.
And I think there's also a taboo element to, dating somebody who belongs to a different party, and men are more turned on by taboos. So I think there's some element to that that's going on here as well.
Interesting. So we end our podcast with some questions I ask everybody. What's something you know now that you wish you knew earlier?
Well, I think a good one would be don't delay pleasure, right? Because sometimes we put off doing the things that we really want to do and that would bring us pleasure because we feel like we have all these other things on our to-do list that we have to do first. And when you start getting into that mindset and you keep delaying pleasure, unfortunately, sometimes it turns out that it's too late for you to experience that. I've seen that happen to too many people in my own life where they had all these dreams and hopes and things that they wanted to do with their life. They delayed, and then a health condition or something else struck, and then that suddenly they'll never be able to do those things that they wanted to do. So don't delay pleasure.
Life is short, and that does not mean just sexual pleasure, any pleasure of any kind. Yeah. So taking that vacation or doing that class you wanted to take to learn, XYZ knitting or jujitsu or dance or whatever, do it because work's always going to be there.
Work is not going anywhere.
Do you have a non-negotiable, something you do every single day?
This is new this year, but it's to go to the gym almost every day. So I've been going about 6 days a week. Sometimes I do actually go all 7. And I have to remind myself that I need to take like rest days from it. But I found that it is very good for just my mental health and well-being. It gets me out of the house, gets me physically active, and just not thinking about work for a while. So it's become an important part of my own self-care routine.
Yeah, I love going to the gym. It's like a little escape from everything. Just focus on what you're doing and do it.
And sometimes it's easier to, do those things that you have to do if you just like take a break and go to the gym first, because it provides this reset, right? That I think is really helpful.
Yeah, I mean, you can only be productive for so long. Do you have a health hack outside of going to the gym or life hack that you want to share?
One of the most important things that I've learned is to say no. We get asked to do lots of different things in our lives, and sometimes too much is asked of us. And lots of us want to please other people, right? We were trained to be people pleasers, and then we end up overcommitting, and we're not happy. That's bad for our life, our mental health, and so forth. And so learning to say no and to set boundaries is something that it's hard to do, but it's an invaluable skill. And I do say no to at least something every day because I just have to for the sake of my own health and well-being.
Absolutely. I mean, no is a complete sentence.
It is.
And it means that you can say yes to the things that really matter. So I think that's a great one. If you couldn't be a psychologist, sex researcher, author, what would you do with your life?
So my very first job when I was in high school was I was hired as a teen film critic for our local newspaper in Canton, Ohio.
That sounds really fun.
And so getting paid to go see movies and then write snarky reviews about them was a lot of fun. So if I couldn't do any of the things that I'm doing now, maybe I'd go back to being a film critic because that was a lot of fun.
That does sound really fun. Where can people find you?
My website is sexandpsychology.com. That's where you can find my blog and podcast. The podcast is also available anywhere you listen to podcasts. And my books are Tell Me What You Want and The Psychology of Human Sexuality. And you can follow me on the socials at Justin Lehmiller or Justin J. Lehmiller, depending on the platform.
Awesome. Well, thank you so much.
Thanks for having me.
Thank you so much for joining us on today's episode of the Rena Malik MD podcast. If you're enjoying the podcast, do me a solid favor and share a rating and review on Apple Podcasts or Spotify. And feel free to take a screenshot and tag me on social media at Rena Malik MD across all social media platforms. And as always, remember, take care of yourself because you're worth it.